Hello, I'm Dr. Heather Norris, Dean of App State's Walker College of Business. Welcome to Business Matters. It is my pleasure to be here today with Dr. Joseph Cazier, Dean's Club Professor of Computer Information Systems and Director of the Center for Analytics Research and Education, otherwise known as CARE. Dr. Sean Bergman, Associate Professor of Psychology, Associate Director of CARE, and Dr. Trent Spalding, Assistant Professor of Healthcare Management and a CARE Faculty Fellow. We are here today to talk about the Center for Analytics of Research and Education and how analytics are used in business. Welcome, Joseph, Sean, and Trent, and thank you for joining me today.
That's great to be here.
So Joseph, let's start with you. That's a mouthful. Center for Analytics Research and Education. What does CARE actually mean and do? And tell me a little bit about the center.
Well, so it's an organization within the college that allows us to apply analytics research on real-world projects and also promote education. And so we're looking at some executive education and other opportunities that we're planning down the road. And also in helping our university and others learn how they can apply analytics, big data, and other things. And one of the things that we're really proud of is that we have a motto in our center of analytics for good. And so we're really focused on trying to use analytics on things that would make a positive difference in the world and very much applied.
So I'm going to take a guess that not all of our viewers know this term analytics. It's one that's becoming a lot more common at our university and in our professions, but probably folks who are in their everyday lives may not be familiar with that term. Sean, can you tell us a little bit more about what is this field of analytics that's growing?
Yeah, absolutely. Yeah, it's a buzzword that is everywhere now. So if you can't watch a commercial that says everybody's engaged in analytics and doing work, and analytics it goes hand in hand with that big data term that also gets thrown around all over the place. And we've actually had several conversations amongst ourselves and some friendly debates about what is analytics. And we've kind of come to the consensus that analytics is it's doing statistics, using algorithms, using computer automated methods to make sense out of the data that you have. And it's a little different than traditional statistics, where traditional statistics, the user is usually the one clicking through and doing all the work. This one is the user sets up some parameters, lets the computer do its thing, and you just kind of monitor and give it guidance to the computer to make sense out of the data. And what's really kind of neat is, smartphones, all the computer electronics is just generating so much types of data that you're constantly having to process all that information. And that's why you need the computer to kind of help you sift through all the information that's coming in and make sense out of it.
So Trent, I have a preschooler. She's about to go into kindergarten. How do I explain what Joseph and Sean just said to my 5-year-old daughter in your field? Let's use that as an example, healthcare.
It so happens I have a 4-year-old daughter who's turning 5, about the same range. And when I tell her what I do, I say that I use everything that's in the computer to figure out how to make life better. So when she gets on the internet and plays games, it tracks data about how well she does and where she has a hard time, and it figures out how to help her improve better. So focusing on individuals and their improvement by using data from everyone else.
Joseph, can you give us some examples of how the center is using analytics that may help further explain what this use of data that's captured in an electronic way, how do we use all of those pieces of data to do good? And some people would say it can also be used to do harm. So let's focus on what we're doing for good.
All right. So first of all, as we look at big data, there's several things that are different about it that let us do some things that we haven't been able to do before. And so that's the velocity of the data is moving a lot quicker nowadays than it used to be in the past. Obviously, volume is implied by the data.
So the velocity is moving a lot quicker. Velocity of what?
So the velocity of the data. So before, maybe you could do some analysis and you could collect some things, but there'd be a lag time that by the time you did your stats or a survey or other things, maybe the customer has already left the store or it's a delay. Nowadays, online.
Okay, let's go to your store example. Break it down for us. I'm a customer. Sure. I'm walking into a store. I'm buying products. How is that business using that information? How are they getting that information? Yeah. And historically, how would they use it? and then tell me now how they can
Well,
use it differently.
so historically, a store, maybe they would have done a profile or done some customer surveys or other things on you. But now they can have a rich repository of perhaps everything you've ever purchased from them, and maybe they can even tie that to what you've done with other organizations by buying secondary data sets and bringing them together. And it can be much more of sort of a relationship to where, just as if somebody knows you very well, they can start to anticipate and predict things that you might like and recommend those to you and anticipate your needs, perhaps even before you know that their needs. And so
For all of our Facebook users out there, for
Sure.
example, the ads that come up on the banners, that has something to do with analytics, correct?
Well, it is, and Facebook is really about, it's about collecting data about you, and it's about advertisements tailored to you, and that's a revenue source. It's not, we usually think of it as just sort of a platform that we use to connect with our friends, and it does that. But there's a business model behind that where there's a massive amount of data that can give increasingly targeted advertisements and other things to individuals with more efficacy, and hence that's where a lot of their value comes from.
So the kinds of pictures I post, the kinds
Absolutely.
of things that I click on, all of that can be tracked, put in a repository, and then people who click on things like me,
Yes.
suddenly a profile emerges of the kinds of products I might be interested
Yes.
in learning about and perhaps purchasing.
And also what your friends do. There's a lot of evidence that people tend to be friends with people that have similar tastes and desires, at least to a certain extent. And so if they see your friends doing a number of things, they might say, well, maybe Heather would like this. So you got 4 of her friends that like this too.
So that would be sort of a marketing analytics
Marketing.
application, but there are
Sure.
many other kinds of applications.
Yeah.
And so I'm going to ask all of you
Sure.
to weigh in on what are some specific, and I know you're all working on different types of projects through the center. So again, you mentioned this idea of using that kind of data for good, and some people might argue that the Facebook use is good or not. I'll say it probably is, because I
Yes.
don't have to look at advertisements that aren't interesting to me anymore. But there are probably even better ways we can apply that. So Sean, you want to share a project that you're working on right now?
Yeah, absolutely. So we're working with the Workforce Development, which is a government agency that's trying to get folks back to work in the 7-county area around here. They're the driving force behind ncworks.gov. And so we're going to be using information and analytics to look at how and what is effective to get folks back to work. They serve thousands of individuals across the county, and to try to look at all of that information one by one as you as a person, as an individual, it's just going to overwhelm you. So using computer and analytics, we can start finding those hidden patterns of maybe it is a certain set of training applications that they do. Maybe it's the time of the year, the time of the week that they come in that has some kind of impact on how successful they are in landing a job and benefiting the economy and all those other good things. So that's one of the ways that we're working on using analytics and just looking over resumes electronically to try to pinpoint folks and highlight them and to put them into jobs that they might not have thought about would be good for them. The classic example is somebody who's a forklift operator, and they've been driving a forklift for 15, 20 years. They have their resume, they have their skills, and they're not thinking that, well, they could become a warehouse manager, because they understand all the ins and outs of how everything operates and moves on the floor in a warehouse, but they're thinking, I'm a forklift driver. We can scan their resume, scan their information in their profile and say, you are a forklift driver, and if that's what you want to do, great, we'll help you become one of those. But you also got a couple other skills that if we add a couple training pieces to this, you now could be a manager of a warehouse. And all of a sudden that light bulb goes on, oh, wow, I didn't think about that. That's something that analytics and the computer and the algorithms can pick up and give us that suggestion and make that recommendation much more efficiently.
That's great. And Trent, what about in your area, healthcare management?
So in healthcare informatics, we have huge piles of data that have been gathering in the servers for years in our electronic medical records. And there are a few large companies who've been using it, mostly insurance companies, but a few large companies like Cerner. They make the computer systems that doctors use in the hospital to record everything about you. For the most part, this data, though, in our medium and small hospitals gets put into a server and left in the back room and never touched again. And if we could leverage that data for those hospitals, they could see very quickly that when we do this type of procedure, this type of problem, comes out, or you have a patient come in and you can start to get warnings really quickly that this patient is going to have certain health risks. You know, and if you move outside of the organizations of hospitals and doctors' offices, even to the individual, you could see that the system could see that you might be at risk for a certain type of disease or chronic illness, and we could use the data hopefully to convince you to change your habits so that you could reduce that risk.
I know I'm noticing some of these applications already in my personal life with the health insurance provider that we have, and they have the interface now that you can get coaching through their system, and I guess it's a signal that they're offering that to me. I should take that to mean that there are some dots that they're connecting behind the scenes.
They're using all your data without asking.
Well, that's good to know. They're looking out for my health and for my well-being and my future. What else are you working on?
So we've sort of strategically identified several core areas that we believe are sort of central to our mission and who we are at Appalachian. And so we have several, and then we target sub-projects underneath each of those domains. So we have one domain is in the area of sustainability. And this is something that's very important to Appalachian, and this is something that many people would consider a pro-social good. And so we've got projects in there. Another one is education. You know, how do we, as an institution or as a society, how do we help people with sort of, educational attainment analytics? How do we help people stay in school and sort of optimize their educational experience? And then we've got projects in healthcare, projects in responsible management and other areas. And then in each of those, we have those sub-projects. So for example, one project we're doing right now is with the local power company, New River Light and Power. And this is a sustainability focus. And of course, the ultimate goal is to reduce power consumption, but also to do it in a way where we sort of understand the power company's costs and business structure so they can do that, but they can also do that in a way that they can afford to do that and have a bigger impact and sort of reduce carbon emissions and other things. And so sort of the first step that we're doing there is helping develop algorithms to sort of predict peak power consumption. So a lot of people as consumers, we tend to pay a flat rate per kilowatt hour, a couple cents perhaps. But for the power companies, the way a lot of their billing works is if they are what we call peak power, that's when you're using the most amount of power across a region, then the price of that power can be, hundreds of times higher per kilowatt hour to them. And that can be almost as much as 50% of their costs in terms of power consumption for a year. And so we're trying to develop algorithms to better predict when that peak power period is going to occur. And if we do, and we lower power at that time when it's most expensive, maybe 13, 14 cents or more per kilowatt hour as opposed to pennies, then there can be more resources to do that. And also, it's usually at that peak power time that you have the worst impact on the environment, because then you're turning on that dirty coal machine or these other things that are less efficient, but you need it to fill the gap. And so we're working to do that. But that's just step one of a long-term project. And so the next step that we're starting is, okay, now that we can sort of have a better idea of when peak power is likely to occur, right? And you predict it based on a number of factors, including weather and who your people are and what their historical patterns are and so forth. And then the next question is, what can we do to reduce power consumption?
Right. That was going to be my next question. So now we've figured out when we use the most power, and we're presumably using a lot of power in those moments because we think we need it.
That's right.
So what is the answer to that question?
Well, so hopefully the power company is rolling out, hopefully soon, smart meters to put on houses. And so as we do that, we're in a process right now to where as we get the smart meters rolled out, and we can get not just aggregate consumption for a region, but we could get, per every few minute increments how much they're using at that moment. Then we can start to, in parallel, predict what's the usage of this particular house going to be. And then tied to that, we're downloading sort of the county and other regional records that has things on it like square foot per house and what type of heating source they have and other things. And we can predict sort of what is their optimal power usage, and we can look for outliers. And then that sort of gives us the prime target of who we can try to work with and say, look, you have the most potential to reduce your power. And then we can, segment the market to where we have students in one group that use power a certain way and at certain times. We have maybe middle-aged professionals that would use power a certain way, and then maybe you have an older demographic that perhaps have different patterns. And then so developing plans to sort of reach them and doing some different trials and experiments to see how it works, some of it with social norms and how things work with different groups, and some of it through other ways, some of it through prepayment plans, but all of them designed to lower power at certain areas.
So you're 3 different faculty members from 3 different areas. How did you all come together in this project? Trent, you're a fellow to the center. What does that mean? How did you get involved?
That means I have a lot of fun playing with data and care. And it also means I can leave a lot of the administrative stuff to these two, and I can enjoy playing in the data. Joe found me. We've been in some similar circles, and as you get talking and you find out you have similar interests, he's a good team builder, and he brought us together, us 3 and other folks from other parts of the university.
And Sean, you're involved
I
in
don't
it?
know what to say after that. That's a great answer. No, so Joe found me when we were working on the analytics master's degree and asked me to be on that task force. And then we got to talking, and we were working in parallel tracks, originally trying to do some applied types of research stuff, me with the industrial organizational psychology and human resource management, the longest master's program on campus name. So we were planning on doing that, and we found out that we were working at like perfectly parallel tracks. And rather than 2 of us trying to invent something at the exact same time, it made sense that we joined forces. And it was early on in a conversation we had in his office that we were going to be an applied research group, and we decided we were going to more specifically focus on analytics for our application, and that is kind of the synergy that we brought. And I'm a stats geek. And so, like Trent, I like playing with data. I read stats articles and stuff on the beach and vacation and that kind of stuff. And so it's fun to play with the data and learn the kind of story that information will tell you. And that's the really, really cool thing. And now we're going to do it. And our tagline that we came up with, Analytics for Good, we're actually doing it. So we're not trying to sell you something you don't need or trick you into doing something else on the internet. We're trying to do something to try to benefit everybody in society.
So, talking about the health area a little bit more, these fitness trackers that are becoming so popular.
We're doing a trial right now. We're calibrating, and we're doing a random control trial this summer. This is sort of a pre-pilot, but we're testing these for sleep and fitness and other things as part of a funded trial that we're doing to see how things turn out.
That's great. So what will this data show us? And I keep hearing you all talk about, we're analyzing the data, we're doing it in a more sophisticated way than our traditional statistics used to be able to. But then there's the behavior, the doing for good side. And so, Sean, you're a psychologist, so I know that you probably have a lot of thoughts on this question.
A lot of thoughts, yeah. A couple things that I think I want to point out is we're in year 1. I mean, we haven't even been a center for an entire year yet. And so before you can, make the change in the behavior, you've got to understand what's going on first. And so some people I've trying to work on coining the term, the analytics mountain that you have to climb in order to, the descriptive statistics, the analytics, the diagnostic, the predictive, and then the prescriptive of we understand what's going on, we can predict it, we can make some predictions, and then proactively get involved in that particular component there. And yeah, the psychology of how to use the information to tell the story about what people are doing, and then get inside their heads a little bit to figure out why they're doing it, what are the motivations that they have for doing that, with the reasons that what they're hoping to gain out of that, what their goal is, and then intercede in those kinds of ways and give them something that's meaningful to react to hopefully change their behavior for good.
Trent, what's the future of our children? Yours is 4 turning 5. What do you see down the line in 10 years, 15 years when yours goes to college? What kinds of, where's the privacy versus the public good of the analytics field?
Well, if I twist that a little bit and then come right back to it, our key or essential contribution that we make in care isn't developing new technology necessarily. The technology is there. It isn't necessarily applying statistics. The statistics there. but can the technology be used to change behavior? Can we teach our students better in their schools? Can they be smarter than we were? If we can they manage technology better? Can we teach them how to understand who has their data and who's using it and use that for their good? The world is a different place if you understand why Google has your data, and then you're more comfortable with it and you know when you do something who's recording it and what they're doing with it. Whereas if you don't know any of that and you go on in life for 20 years as a college student and post things on Facebook that show up later to haunt you, then all of a sudden the technology is scary. Analytics doesn't have to be scary if we understand it.
So advice for our 5-year-olds is whatever you put out on the internet will be there, or a footprint of it will be there, or the data related to it will be there, and so sort of plan accordingly and then use that to your advantage.
Yeah, I would say, one, you need to be yourself everywhere. Used to be we were completely anonymous online. You need to be a genuine self. You can be tracked down and found now. You can't hide completely online. And as we're less and less anonymous, we need to be more genuine and real. And the second is we should apply some of the same rules about talking to strangers and figure out how to apply them online for those young folks, particularly probably educating their parents first and helping them understand so they can teach their kids. If their kids have to figure it out first and then teach the parents, usually it's too late in a few different items.
That's great advice, I think, for young and old alike.
So I would tell that to the college students too. Our college students and our grad students, we have that conversation because one of the fields in HR that's a huge area of what are you doing online and how is that going to impact your employment decisions. And sometimes some of those unfortunate things that you thought would be funny or witty to put on there can come back and have some repercussions, and you just weren't thinking that far ahead when you did it.
So we're starting to do a lot of things with text analytics in our center. And so with text analytics, you can sort of take a writing sample, and there's a lot of things that you can start to understand about a person. You can get signs of depression, you can get signs of their personality style, you can get signs of sort of how they think and where they think. You can get clues for how well a group's working together, because when they are working together well, their writing seems to merge, just like if you're having a conversation and you sort of mirror the body language, same thing happens in writing samples, and you can track that over time. But all these things that are out there can give clues to, who you are and what you're thinking, and even your mental state and your thoughts on that. And so, and it's interesting that if you look at the content words, that sort of tells you what you're focusing on. But if you look at the non-content words, the words that most of us ignore, then that tells you how you're thinking and how you process information.
Fascinating.
And you can reach that. And so we're hoping to start a trial here with some friends in English and other parts of the university, looking at sort of words about breast cancer and other things, and looking at people's attitudes and how they write or how they blog about that, and what that says about how they perhaps can be reached to get the different treatment. And so this is sort of a healthcare approach. We're doing things in education to take writing samples, both perhaps at the university and perhaps in the public schools, and look for flags of this person's in trouble, we need to give them a little extra help, or maybe this person's doing very well, maybe we can optimize and put them in more of an advanced program, and trying to understand that and look for early clues before it's too late to do something about it, and help ensure your children and my children and Trent's and everybody's future.
That's great. Yeah, it sounds like we've come a long way from reading a two-dimensional email that's in all caps and saying, oh, this person's feeling angry today, to really being able to dig into more subtleties about language usage and looking at, as you've said, putting lots of different pieces of data together and looking at the big picture to start to see what those patterns are and predicting, okay, if a person uses all caps for 5 days straight, then there may be something going on. They may have just forgotten they left their all caps button pushed in, or there may be some other underlying issue that we need to address. So I'm taking it then that really it's you all are finding the patterns in the data and the predictiveness of that data, and then the intervention, the behavioral part would be with your computer
That's right.
usages and programs. And then the next step would be a human kind of intervention or a human interaction, perhaps, or a virtual one to then bring in that virtual coach or virtual psychotherapist or trainer in that educational piece.
Sure. So, I mean, one of the first projects we did was sort of with medical device compliance, and if somebody's using that, how do you encourage them to use it appropriately, and can you measure that? Can you send a signal to their doctor or a parent or a child or something to if there's a problem or other things?
That's great. Thank you so much for being with us today. That's our program for this week. Please join us again for Walker College's Business Matters. I'm Heather Norris.